Also, it includes broad collaborations, and this is kind of what we did with the Center for Arts and Medicine. Again, concentrating on the well-being for all Floridians. Of course, leadership and direction, that led to what we felt was an important partnership in improving the quality of life. So our strategic issue, one of which was partnerships and collaborations. So how do we create these partnerships and how do we impact the community? So next slide, really. Partnering with UF Shands Arts and Medicine program, well, it's not new to us. This started way back in the 1990s with a very small investment, and it was this kind of crazy grant application we received, and we're like, well, that sounds interesting. Let's invest in this. So we started this great relationship with Jill Sankey and her team based on the common goals of healthy communities and strengthening the quality of life through the arts. So not just usefulness, but as a therapeutic research tool on how arts affects health, but also ways to show constituents and funders the value of the arts beyond arts for art's sake, and to show that arts and culture are intrinsic to healthy communities. So the Florida Arts and Wellbeing Indicators project was a step towards strengthening that mission and towards documenting Florida's investment in the arts and that having a positive health impact on communities. Again, this aligns completely with our strategic plan, and it's important data that has been gathered for arts advocates and for organizations, keeping in mind that in order to collect this, it must also be distilled and disseminated through current information modes. We are so proud of the relationship with Jill Sankey. But, this project really was a 3-year phase, and we chose to make that investment with some funds available through our NEA partnership agreement. And the overreaching goal of the project was to develop a set of indicators that could measure associations between arts participation and well-being on the community level. So again, I can't thank and I can't stress the partnership of our folks with us today. Not just the work they do in Florida, but in the world. This program that Jill has developed really goes beyond the United States. It's an internationally recognized program, and we couldn't be more proud of the meaningful partnership. So really, with that, it is my great pleasure to introduce our brilliant partner, colleague, and friend, Jill Sankey, Director of University of Florida Center for Arts and Medicine and Assistant Director of UF Health Shands Arts and Medicine Program. Jill.
Thank you so much, Sandy. And I echo Sandy's comments about our partnership. We're just so honored and thrilled to partner with the State of Florida Division of Cultural Affairs and have been honored to do so for so long. This project was particularly exciting for us. I think it gave us all the opportunity to explore something that's really critical after all the years that the state of Florida has been investing in arts and health, to really get down deep into the nitty-gritty of how can we really know that this is working and what kind of impact the arts have on citizens at the state and at the community level. So we were really honored and thrilled to do this work. So huge thanks to Sandy and to Paul and Eric for hosting this conversation today. I'm going to launch us this afternoon by giving you all an overview of the Florida Arts and Wellbeing Indicators project. And then I'm going to turn over to Jasmine Mack, who is our incredible statistician, to look specifically at the outcomes that came from this research initiative. So Jasmine, you see here in the center of this slide, she is among a number of people on our incredible team, and I just want to acknowledge all of the scholars and researchers who have contributed to this work over the past 3 years, those you see on the slide there. And harken back to Sandy's point about where this all came from. It really came straight out of the strategic plan after it was created. the question of, we say all these things about arts and their impact on health in our state, but how do we really know? So the question arose, could we create a set of indicators that would help us associate the arts directly to well-being, not so much at the individual level, which is what we've been doing in clinical studies in our healthcare environment, but could we make that association at the collective community level, population level? And so we brought in Jasmine and the other incredible members of our team to help us undertake this project. I want to also note that we're not alone in this sort of work. I just love it when you have an idea, and actually I give Sandy 100% credit for this idea. You have an idea and then you see that it's happening all over the world. You didn't know because it wasn't visible at the time. But indeed, the time has come, and others are questioning the associations between the arts and health at the population level as well. So by the time we got into the third year of this project, we were able to see quite a few similar projects taking place around the world. And you'll see those listed here. I won't go into too much detail about these, but just to note that overall, we looked at about 12 or 15 projects around the world that were working to associate the arts with health at the community level, many of them doing truly extraordinary work. We did focus down on a few particular ones as we began to do our work, and were really influenced by these. The Wellbeing Project, undertaken by the City of Santa Monica and the RAND Corporation, is a really outstanding example that we looked significantly to. And in particular, the Soul of the Community, which was undertaken by the Knight Foundation, included Florida data, and we truly developed our first indicators model as an adaptation of the Knight Foundation Soul of the Community indicators model. The City of Sydney, Australia's model was also very influential for us, as was New York City's Well-Being of New York Neighborhoods project. So those are initiatives that you all can look up online. They're readily accessible and have really beautiful reports. So to dive into our project, this, as Sandy mentioned, is a 3-year initiative that we've just wrapped up. And year one, which was 2015-16, the first year of the initiative, we were really starting with square one, and we knew we needed to look to the literature to begin. So we started with in-depth literature review, and we carefully examined over 70 studies that had attempted to associate the arts with well-being in some way. We were looking at their methods, looking at what variables they used, the samples that they were looking at, their designs, limitations, all of those things. And that's where we came across the Knight Foundation's work. And we developed also, as a starting point, a set of 10 potential survey questions that would help us develop these associations that we were looking for. And we were able to pilot those questions in a state of Florida survey through the Florida Survey Research Center. So it was a telephone survey, and we were able to get answers to those questions from 500 people who were demographically representative of the population of the state of Florida. We were also able to develop a primary set of variables and an initial set of indicators in year one. So we went from there to looking at outcomes that came from those 10 questions in the survey, and we saw really promising indicators. As you can see on this slide, those who participate in arts activities as compared to those who don't reported being more satisfied with their lives. They reported good to excellent health, higher levels of health than those who didn't participate in the arts, and also higher levels of community quality of life. So this was a good indicator to us that we were on track and that we could actually associate the arts with health at the community level. So we went then into phase 2 of the project with a goal of developing a set of primary measures, so testing and validating measures that we compiled into a single survey instrument. So we took the 10 questions that we tested, modified them slightly based on our results, and we also adopted a few sets of validated measures from using NIH promise measures, a flourishing scale, and some World Health Organization measures. So we created a single survey instrument that could answer all of the primary data questions that we knew we needed with validated questions. We also were very interested in comparing those primary measures that we were collecting directly from citizens with secondary data sets, so statistics that were available related to community well-being, community engagement, health, those sorts of things. So we worked in the second year as well to identify secondary data sets that we could potentially use in our statistical model. We also used focus groups to triangulate and to create a qualitative layer for our data collection. So we didn't want just quantitative data to make these associations, but we wanted to sort of back those up with some qualitative data. So we conducted focus groups to do that. And we tested in this year in 3 counties in the state of Florida, in Alachua County, Miami-Dade County, and Lafayette County. And those 3 counties were very carefully selected based on their demographics. We looked at population levels from an urban to rural density component. We looked at health disparities, and we looked at overall demographics. So we ended up with 3 counties that represented rural, suburban, and urban populations, again with varying levels of health and socioeconomic disparities present. And we developed a preliminary statistical model in this process as well. So this is what our indicators ended up looking like. We had 3 primary domains. So we had 2 indicators in the area of wellness and multiple variables associated with each of these indicators. But essentially, we had questions in our survey that look at health and quality of life pertaining to wellness. We also had a number of arts indicators, including arts participation, access to the arts, value of the arts, infrastructures for the arts, and investment in the arts. And then we looked at a number of community indicators as well: civic involvement, satisfaction with leadership in the community, openness, safety, social capital, and satisfaction with community. So again, each of these indicators has a number of variables associated with them, and we were able in our single survey instrument to garner information around each of these indicators. So as we moved into our 3rd year, we were really concerned with validating that survey. So we experimented with some minor revisions to the survey and have ended up reverting back pretty much to our original version. So we continued to test the survey, and we were really interested in this 3rd year in testing the statistical model, making sure that we had a statistical model that would garner reliable results. We also were interested in testing in additional rural counties. We'll return at the end of our time with you this afternoon to more dialogue about our experience in rural counties. But essentially in our 1st year of testing, which was year 2 of the project, we discovered that the survey itself may not be appropriate in rural communities. We were met with some frustration from rural community members around the assumption that they felt we were making that they had access to the arts in their small communities. So we were very interested in that early finding and exploring it further, which we did in our 3rd year of testing. So we also in the 2nd year began the development of toolkits. One of our primary objectives with this work was to create a tool that could be used not only by us, but by anyone, that could be scaled at any community level, town, neighborhood, county, state, and could be used easily by anyone in the United States. So we developed toolkits for use of the indicators survey and for data analysis. We also were interested in developing conclusions regarding the usefulness and reliability of the instrument, which we did. So all of that information, I'll provide you with the link at the end of our talk this afternoon. In year 3, we did undertake additional testing in a total of 7 counties, 5 new counties, 1 in South Florida, a number in Central Florida, and 1 in North Florida. And we also integrated our Miami and Alachua County data so that we garnered both state and county level data from our third year of testing. In the second year, we did a lot of this work ourselves. We did data collection in Alachua County ourselves because we wanted to test as many data collection methods as we could. We also engaged with partners in South Florida. In the third year, we were very interested in passing off the role of data collection to other organizations. So a number of organizations from Central Florida came to us in the second year and wanted to work with us in the third year. So we did, in fact, pass off that data collection to organizations in the third year. We provided training, we provided access to the instruments, and these partners who you see listed here undertook the data collection. Florida Hospitals was an early partner and helped us link to the arts partners in Central Florida, but they didn't undertake data collection themselves. So I referred briefly to surveying methods. One thing we recognize is that in developing a tool that we wanted to be able to be utilized easily by arts and other organizations, we knew we had to test methods. So in both years, we tested as many ways of administering the survey as we possibly could. Survey administration with assistance, without assistance, via email, using iPads. We had surveys available in each format in English and in Spanish, and phone surveying. So we tested every method that we possibly could and reported on what methods were most efficient and most effective. And I'll share that information with you in just a moment. So here you have cost information. Again, we wanted to make sure that we weren't creating something that took loads of money for people to undertake themselves. We knew we needed it to be highly cost efficient and time effective. So we tracked the investments that we and that all of the partners made in data collection and data analysis throughout. So here you see estimates that came from our testing. You can see in the top table that it, on average, took about 145 hours for each county to collect the data that they needed, and the costs came in right around $5,000 on average. And if you look at the table below, you'll see a huge variation in cost, and these three counties were the counties we tested in our second year. In Alachua County, you see that that cost is quite a bit higher, and that's simply because we tested telephone surveying in that second year. Telephone survey is one of the most reliable ways of getting a demographically representative sample, but it's also one of the most expensive means of survey collection. So 100 of those surveys collected had a cost of $5,000. So without telephone surveying, you can see in Miami-Dade County that a demographically representative sample was achieved for about $3,700. And we feel that that range, $3,500 to $5,000, is a good average range for what costs would be. Lafayette County, the rural county in which we encountered our challenges, you can see came at a low cost, but also did not achieve its goals. So we feel that over these 3 years, we were able to achieve a reliable instrument, and Jasmine is going to share some of our specific outcomes and results with you in a moment. And we feel that we were also able to create instruments that are useful, cost-effective, and efficient, as well as toolkits that can enable people to use them. So we'll come back to discussing the toolkits at the end this afternoon as well, but I want to pass it over to Jasmine now to talk with you about our findings.
Thank you so much, Jill. So in terms of our analytical data management, the analyses included combined data from phase 2 and phase 3 periods in order to increase statistical power. 79% of the surveys received were used in the final analyses, which yielded 1,444 surveys, and we excluded respondents who resided outside of Florida. If there were significant data, we also excluded them, especially missing the arts participation questions, which is our exposure variables. We asked in the past 12 months have the respondents participated in any local arts activity, such as attending a live show or going to the museum, which is defined as formal arts participation within our study. We also asked if they participated in any hands-on creative activities, such as playing an instrument or dancing in the last 12 months, which is defined as informal arts participation. So this map of Florida shows where the survey respondents live by county. The blue stars represent our target counties for data collection across phase 1 and phase 2 and phase 3 of the data collection period. And the majority of the surveys were collected from Alachua, Putnam, Orange, Broward, and Miami-Dade residents. There are also other participants in surrounding counties of our target areas that we were also able to collect surveys from. So there were 3 types of primary data analyses we performed, and the first one included comparing demographics and indicators across the different arts participation groups, which are no participation, formal arts only, informal arts only, as well as both within the past 12 months. These groups were also collapsed to look at no participation compared to any form of arts participation. From a cross-sectional comparison, a significant amount of time went into building a statistical model that accounted for the demographics as well as the community vitality factors that differ among those that participated among the arts and those that didn't. This is where we created indices for measures of civic involvement and social capital, for example, to ensure sufficient model fit. We also had to account for the method of data collection, which was paper electronic, as well as the site of data collection, whether that was Alachua, Orlando area, or Miami-Dade, for example. Lastly, we performed multivariate linear regression models to measure the predicted influence of arts participation on the promised measures of physical and mental health, as well as flourishing. So this demographics table represents how the characteristics differ by arts participation. And in this sample, more females participated in the arts than males within our sample. Arts participants were also more likely to be older, more likely to be white or Hispanic Latino, attend higher education, and to have higher income, as well as to have their health checked up in the last year. There were no differences that we noticed in marital status, as well as medical insurance, for example. One major finding is that there is a significant difference in health and flourishing when comparing those who participate in the last 12 months compared to those who did not, where those who participated reported better physical health and they scored higher in short flourishing. Both groups were comparable in mental health symptoms. In a logistic regression, these statistical differences in health and flourishing no longer existed when accounting for demographics and other well-being indicators like social capital. In terms of demographics, females were 2 times more likely to participate in both forms of arts compared to males. Non-Hispanic Black respondents were about 80% and 65% less likely to participate in both forms of arts and formal arts only, respectively, compared to non-Hispanic whites. These results were also adjusted for education, income, quality of life, and other indicators that proved significantly different between these groups. On this slide, these results are a continuation of the logistic regression results seen on the previous slide. We found that respondents who participated in both forms of arts were 31.5 times more likely to report the arts contributing to their personal quality of life and 5.1 times more likely to be involved in their communities. There was a strong finding across the board where any level of arts participation was associated with arts contributing to personal quality of life after accounting for the health measures, demographics, and other indicators. The adjusted analysis did not find a significant difference between community quality of life and arts participation, but there is a difference in social capital where those who participate in formal arts only reported 2.4 times more likely to also score higher on a social capital index compared to those who did not participate. Overall, we know that those that participate value the arts as positively affecting their quality of life, which is also connected to how they physically and mentally feel. The next statistical model addresses the question of how arts participation predictively influences health. When we adjust for all art participation groups, for each promised measure, there is a strong statistical linear association between participating in both forms of art and self-reported physical and mental health, as well as flourishing. In terms of variability, arts participation accounts for 5% of the variability seen in global physical health, 3% for flourishing, and about 7% of the variability seen in global mental health. Simply, the linear model where mental health was the outcome was a better model fit, and it does provide evidence that arts participation may be a better indicator of mental health symptoms when adjusting for basic demographics in this specific sample. These results would need more statistical testing with a large and representative sample to further explain differences that we've seen in variability. So there are several limitations to these findings. The results are based on self-reported data, which may introduce recall bias, or participants may not remember participating in the last year, or they may believe they participated in the arts when it did not occur in the past year. There was also sampling bias. Survey respondents were recruited at art-centric locations. At least 90% of the sample had some form of arts participation. Lastly, these results do not imply that arts participation enhances well-being or the reverse. We found that there is a significant association between arts and well-being. Respondents are only captured at one time period, so we cannot say if arts participation comes before or after self-reported health measures. So in terms of the generalizability of these results, those sampled were largely female as well as non-Hispanic, white, and Latino compared to the overall Florida demographics. There was an underrepresentation of non-Hispanic Black residents, so further survey implementation across these groups would increase generalizability or how well the sample and the findings are able to represent the population as a whole.
Thank you, Jasmine. So what you're hearing in these results is not only promising in terms of the potential benefits of the arts to health, but mostly promising in terms of our ability to measure those associations. So our goal in this project was not so much to find positive associations, but to develop a way of consistently and accurately identifying those associations. And we feel very strongly that we've developed a model that has the potential to do that work reliably. And we're very interested in, Jasmine noted, in continuing to collect data so that we can continue to develop outcomes that can be more generalizable. So in the third year as well, we found that we were able to integrate the secondary data sets, which was a very significant undertaking, and we felt a great accomplishment that we were able to integrate secondary data sets regarding health, community engagement, investment in the arts. We utilized the Americans for the Arts economic, the AEB5 data that you're all probably familiar with, which was a very useful data set for us. So we're very excited about being able to integrate the data set, the secondary data sets with the primary data sets. I'd like to return just for a moment before we open it up to your questions to discussing the urban, rural community differences and the applicability of this instrument. We found very significantly in both urban and suburban communities that the survey instrument, which took an average of about 12 minutes for people to complete, was really enjoyable for people. We found that when the survey was offered or introduced, in general, people were happy to approach the survey because they were interested in the topic. And that was very exciting to us. We did not find significant resistance to people completing the survey. That was not true, however, in rural communities. So we do need to continue to do that work in rural communities. And Sandy and other division staff engaged in conversation with us with shared concern about availability of the arts in rural communities. So we understand that that's a concern for all of you, and I think that topic wraps in very significantly to this work. So we do feel as we offer these tools that they're very appropriate and effective in suburban and urban communities, but perhaps not so much so in rural communities at this point. So we have the opportunity before us to develop instruments that might be more applicable in rural communities. I also want to emphasize the importance of partnership. As you saw in our data collection, especially in the third year, we had strong arts partners, and therefore data collection was undertaken in association with arts events, so at arts festivals and things like that. In the second year, we had a broader range of partners. We had health partners as well as arts partners, and we ourselves collected data in supermarket parking lots and public parks, at bus stations. We were careful not to collect data just at arts activities. So partnership is exceedingly important in that regard and ideal. So in a particular community, a partnership between a health department or a healthcare provider or a public health program with an arts organization or agency would be ideal in guaranteeing or achieving a more demographically represented and therefore less biased sample. So we just want to note the importance of partnership and also the opportunity that this indicators project would afford for a community to develop cross-sector partnerships between arts, public health, and community development organizations or agencies. And just finally, we're, as I mentioned, hoping to continue to collect more data, to continue to test our statistical model. We've developed toolkits for both survey utilization and analysis, and they're available on our website. We'd like to continue to disseminate those tools, and we would like to be able to collect data that we can continue to analyze from other counties in Florida and other states in the nation as well. So here's a link to those toolkits, which you can find on the website. And as Sandy reminded us earlier today, there's an exciting publication forthcoming in March, I believe around mid-March, the Rural Prosperity Through the Arts and Creative Sector, an action guide for governors and states is coming out, and that will really be helpful for us in addressing those rural issues that we mentioned a little bit earlier. So we'd like to wrap up our presentation now and turn it over to you all for questions and dialogue.
Well, thank you, Jill, and thank you, Jasmine and Sandy. Great presentations. I really appreciate it. So as Jill said, we're going to open the conversation up for questions. You can send us a question via the chat box you see on the web seminar platform, and we'll do our best to get to all of your questions and have a great conversation. To begin, I'm going to turn to Jill and ask you to talk a little more about what you're saying about the resistance you experience in testing those indicators in rural communities. I agree that expanding this work into small rural communities is very important, as these are places that often have less access to both the arts and healthcare. And I'm curious if you have any perceptions, any thoughts about what could be done to improve acceptance and facilitate this work from spreading there.
Yeah, I think there are a few things. One is the sort of outsider effect. When we came into rural communities as outsiders to collect data, that wasn't really received well. We were, perceived as outsiders, as researchers, even though we had some of our wonderful young students doing that work. So we learned very quickly that partnerships and that the communities need to have an interest in collecting that information themselves and need to do that data collection themselves. And when we did in the third year garner some partnerships in 3 rural counties, we were able to see a much more successful level of data collection. We didn't quite reach statistical significance in any of our rural counties, but we did have local partners who were just fantastic in facilitating data collection in rural counties. I also think it's important to note that, in general, it's hard to create a one instrument that fits all scenarios. So we're delighted that this instrument worked well in suburban and urban communities, and it makes perfect sense that something different may need to happen to collect the data in rural communities. We're not convinced that this instrument couldn't work. I think one of the underlying issues is that many of our rural communities simply don't have the kind of access to the arts that community members would like, and the resistance that we found reflected that. Some of the people who were approached with this survey were offended by the assumption that they had access to the arts. They clearly wanted that and felt that they didn't have it, so that created a barrier and resistance. And we were measuring both informal and formal arts participation, but we weren't even able to sort of get past the introduction into the survey because there was that perception that they were lacking a resource that other communities have.
Now, thank you. So in some communities, there wasn't access to the arts. In the county you're working in, were there other communities that did have a local arts agency or another cultural institution to partner with? And also a question came in about what the main industry is in this community you worked in.
So we worked in a total of 3 or 4 rural communities, and in at least one there was a local community arts organization that we partnered with, and that's the county in which we did have most success with data collection. So I wouldn't say across the board that there's a total lack of access to the arts in those communities, but we certainly saw differences between our suburban and urban communities and our rural communities, at least those that we tested.
Okay, thank you. Another question came in on this topic, a lot of interest here on this, about whether, about the disparity in responses from women and men, and whether there should be more focus on trying to reach an even number of both women and men in doing such a survey.
Without a doubt.
Okay.
Yeah. And that, again, I think comes down to partnership. Again, in the third year, we partnered with with arts organizations. And so the survey was being administered largely at arts events. And the ballet and the opera, the symphony, I don't know how their audiences, would be shake out in terms of male-female comparison, but that is something that we would like to continue to investigate through, again, the qualitative triangulation that we did in the focus groups in the second year, is understand, are women actually participating in the arts more in general, or are they more open to being surveyed? There's a few possibilities there that could warrant further exploration.
That's a good point. Turning to a different topic, I want to bring up the data collection toolkit and the data analysis toolkit you mentioned right at the end of your presentation. Those resources are available for free on the project's website, as well as the indicators that you developed. And I was curious if you and if Sandy would like to chime in as well, who these resources are designed for and how they can be adapted by other states or organizations working elsewhere in the country.
Great, I'll start. We do have those resources available. So on our website, you can find our full report, which is much longer and more tedious than anyone actually wants to read. But all of the details of our work and our findings are included in an executive summary that's about 9 pages long, and then in a full report, which is dreadfully long. Along with those things, you can find the toolkits that we developed. There's the survey toolkit, the data collection toolkit, and the data analysis toolkit, which is designed to be used by a statistician, but doesn't require, super uber statistical expertise. Jasmine, would you agree with that?
No. So the way that we've set it up is where we do have a SAS code, but it's documented pretty extensively. You would, of course, have to follow through, and it will output the results for you. Of course, you will have to have availability of the software, which is not cheap. But of course, depending on the organization, we can always work with them in terms of assistance that they'll need in analyses.
And again, hearkening back to the importance of partnerships, many health institutions and academic organizations or larger city or county organizations may have access to these softwares. So partnership can be really helpful in that regard in terms of keeping costs down. So the survey itself is available. We have a survey template in Qualtrics and in SurveyMonkey. And those we will provide, again, free of charge, but you would need to email us to get access to those resources. So everything is available, and we're set up for anybody to jump in and use this instrument. And again, everything can be done independently from data collection to data analysis. We are really open to and quite eager to be engaged with anyone who's using the indicators, because we would like to pool the data. We would love to take any data that is collected and pool it for further analysis and further testing of the statistical model. And we're, again, happy to provide assistance to anybody who's interested in using this instrument.
Great, thank you, thank you. And Sandy, is there anything else to add?
Well, I think Jill covered it, emphasizing the free access to the toolkits and to, the model that they've built. I want to just make sure that you don't dismiss the statistician component of it because, that does take, Jasmine is saying not so much, but yes, I think that the statistician is an important part of trying to figure out what comes out from the tools that you're using. And then I could talk a little bit more about relationships if we get a question like that. But Jill covered this topic pretty well.
Well, as it so happens, Sandy, the next question is for you, and it is about relationships. You've had, the Florida Division of Arts has had a long history with the University of Florida, with Jill's office. And it's been very productive. And I was curious if you could talk a little more about how other state arts agencies could approach beginning a partnership with a hospital, a university, or another stakeholder in the healthcare industry.
Sure. And it's all about taking a risk. And sometimes you have to take that risk. But establishing the relationship. Research models in your own state. For example, if your state has one of the Creative Forces VA sites, tap into that program. Become friends with whoever the creative arts therapist is there. Research healthcare organizations that have arts therapy programs. For us, universities, and in particular the University of Florida, has been a great partner, especially a university that has an established program with a teaching hospital. We've also talked about reaching out to medical schools to encourage young doctor wannabes before they get too burnt out on the whole medical school thing. Look, here are the benefits of the arts. Here are the benefits of this type of work. Some medical students could use art therapy themselves to get them through medical school. And again, take that risk to get the ball rolling, even if it's just a little bit of money. Carve out some of your discretionary funds if you have some. We don't have any, so we decided to use some of our NEA partnership agreement for this commitment for arts and healthcare, arts and well-being, and that's how we've developed it, with a solid relationship with Jill and her team. And it all goes back to finding arts-based solutions to science-based issues or problems or situations. And when you marry those two, it's amazing. Also having the whole academic world involved, even though sometimes we don't speak the same language and you need a PhD to understand some of these academic folks, it's really important to have the academics, the arts, the healthcare all together and on the same page.
I agree, and that was a great phrase you just used. I'll ask you to repeat it. Art-based solutions for what did you say? That's wonderful.
For science-based issues or science-based situations, or I don't want to call them problems, but we find that we could connect the dots to all societal ails through the arts. So in this particular case, we're using some very solid arts-based toolkits in Jill's case for a science-based question, basically. Mm-hmm.
That's wonderful. That's wonderful. And Jill, do you have any other thoughts on that?
One thing's come to mind as we've been talking this afternoon, and that's when Sandy and I first started talking about this project, and in relation to their strategic plan, we also saw it as a really exciting opportunity for the division and for arts organizations in general to make connections with other state agencies, to make or strengthen connections, with state agencies like public health, the secretaries over health and community development areas. And I think that that's a really great opportunity. We've seen it at the county level, partnerships between arts and health agencies and organizations. And I think that's a really exciting opportunity that undertaking this kind of assessment can afford. It can really help other sector leaders understand the value and importance of the arts, and could really shift the investment landscape in that regard as well.
And if I could add just one thing to that, not now, but a long, long time ago in the 90s, we partnered with the Department of Health, and a very brilliant doctor was one of our panelists, and he reminded everyone that before medicine was a science, it was an art. And he went back to stories with shamans and things like that, and it was really impressive to have a man in his position say something like that and to connect it.
That's a good point. And you, the two of you, have laid out really the case for the arts and how the arts can help other sectors, and there's a real synergy there, potential. And people are paying attention in other sectors, people in the healthcare industry. I'm curious if this work, your partnership, is getting the attention of policymakers. Is it getting the attention of state legislators in Florida, for example? This is good news. This is a great demonstration of the power of the arts and public support for the arts, and I'm curious if the people in the legislature are paying attention.
Well, we'll soon find out because session starts March 5th. But on our own level, the Department of State, the Secretary of State is very supportive of arts and healthcare initiatives, and she was very impressed by a brief presentation we did for her. She's kind of new. I think she's been here, 3 weeks, 4 weeks? So we haven't done this whole presentation for her, but she's very impressed with the presentation we have done with her associating arts and health with the arts. So again, session begins March 5th, but my opinion is that whatever side of the aisle you are, whether you're House or Senate, you should be interested in healthy communities and well-being. And that's just a matter of, like what we said before, connecting those dots to the arts and culture. We have a wonderful opportunity coming up in September, again, partnering with Jill and partnering with United Health of, I think it's in Orlando. What's the name of Orlando Health and United Arts?
United Arts of Central Florida.
United Arts of Central Florida. So we're looking forward to September. And I don't know if Jill can speak a little bit more about that.
Sure. That conference is a part of our national initiative called Creating Healthy Communities, Arts and Public Health in America, in partnership with Art Place America. And it's an open conference at the Dr. Phillips Center for the Performing Arts, September 23 and 24. So that conference will host dialogue and also showcase really impactful and exciting programs working at the intersections of the arts, public health, and community development in Florida and beyond. So if you're interested in this association, I would definitely recommend that you hold those dates and watch for further information. I'd also note, in regard to policy, as a part of this initiative, we just held a national policy convening in Washington, D.C., and it was very exciting and heartening to see a lot of policymakers come together. There were 50 policymakers who came together at that convening, and I sort of talked about it. It was one of the rare experiences I had with an audience that was not necessarily the choir, where everybody knew exactly what we were talking about in relation to the connection between the arts, cultural participation, and health and well-being at the community and public health level. And there was a ton of synergy and interest among those policymakers to see the arts become a part of policy, not just public health policy, but other policy. So I think we're at an interesting time in terms of interest regarding how important the arts are to health, and not just arts that are specifically developed for health or programming specifically developed for health, but the arts in general. And there's a lot of interest in developing ways that the general public can begin to better recognize that the arts, like good nutrition and like exercise, are simply good for us and part of healthy, thriving lifestyle. So I think we're moving into a time where we're going to see shifts around arts and health at the public health and community level. And that's a very exciting opportunity for the arts sector.
And if I could also add, for my fellow state arts agencies out there, if you're not tracking legislative bills, please do so, because sometimes there's a bill flying through the House or Senate that you might not think can involve the arts. For example, right now I'm tracking a bill for alternative options for treatment for veterans. Well, after reading further down in the bill, it includes music therapy. So then that's an in for me with that senator saying, hey, do you know XYZ? So track your bills, even if you don't think they involve the arts.
Thank you, Sandy. That is a very good point, and a recommendation I will take myself as I track state legislation around the country, and we'll keep you up to date about what comes out of that. And Jill, thank you for that point about art being like exercise and a balanced diet, just integral to core health, just to well-being. That is a very important point and one that's overlooked often, and I'm glad that you are working to make sure more people understand that. And with that, we are coming to the end of our time together. We don't have any more questions, so if I'm going to turn it back to you if you have any last thoughts you'd like to share.
This is Sandy. I just, again, voice my appreciation for NASAA bringing this topic to us today, and of course for Jill and her team. Thank you so much.
Echoing those thanks, and I want to take just one moment to introduce one other member of our team who's actually been here with us, Max Helgamo, our research coordinator, who's responsible largely for those amazing toolkits and has provided training and guidance to organizations around the state who have used the indicators. So Max is here as a resource to us. So huge thanks to Max and to Jasmine for being here and for the great work on this project. And as well, thanks to Sandy for the ongoing partnership and inspiration, and Paul and Eric for hosting this dialogue today.
Great. I couldn't do it without Curtis. He's the brains behind all the technology. So thank you, Curtis.
Great, and thank you, Sandy, and Jill and Jasmine. I appreciate you sharing your work today. It's really wonderful what you're doing, and I'm proud of it and thankful that you're doing it. And thank you all for tuning in today to today's Florida Arts and Wellbeing Indicators web seminar. We will have a recording of the seminar posted on the NASAA website in the near future, so you can listen in at a later date and share it with colleagues. And with that, I'll thank Sandy, Jill, and Jasmine again and wish everyone a good week. Take care.